Hello, my name is Dr. Rani Banik, and welcome back to my 5-part video series on macular degeneration. In video number 2, I'm going to be explaining to you about the 2 main categories of macular degeneration. So if you remember back to my first video, I explained about the initial problem that happens in macular degeneration, which is that waste products are not cleared from underneath the retina. And these waste products accumulate and they tend to grow in size and number. The waste products are called drusen. And when there is the presence of drusen, it is called dry macular degeneration. So simply having drusen puts it in the category of dry macular degeneration. Now there are stages of dry macular degeneration. There's early dry macular degeneration, intermediate, and then advanced. But what happens is over time, the drusen increase in size and number. Sometimes they begin to coalesce. However, with time, as those drusen are increasing in size and number, the drusen trigger inflammation and then a series of events that ultimately leads to new blood vessels forming underneath the retina. These blood vessels should not be there. They are not healthy blood vessels. In fact, they're quite fragile and they tend to leak and bleed. And so when the drusen have incited inflammation and new blood vessel formation and leakage, then the dry macular degeneration has transformed into wet macular degeneration. Now, the way I like to think about this is that wet macular degeneration is the result of inflammation, and it is a type of leaky eye syndrome. Now, if you're familiar with the terms, other leaky conditions within the body, for example, leaky gut or leaky brain or leaky heart, wet macular degeneration is similarly a type of leaky syndrome in which, again, blood and fluid and proteins that should not be there accumulate underneath the retina. They can sometimes develop into the retina and cause dysfunction and vision issues. So again, 2 main categories of macular degeneration, dry and wet. Dry can be early, intermediate, or advanced, and then wet is when there is blood and fluid and proteins that have leaked underneath and into the retina. And in my next video, I'm going to explain to you about what the symptoms you may have if you have either dry or wet macular degeneration. So please stay tuned for my next video, video number 3 in this 5-part series.